Welcome to this explainer, brought to you by our team at Next Level Speech and Physiotherapy Center, right here in Dubai. Picture this for a second. You're at a playgroup. The other kids are just chattering away, they're pointing at toys, loudly asking for whatever they want, but your child is a bit quieter. Maybe they just gesture or pull you by the hand, or get super frustrated when you don't instantly know what they need. Look, it's a moment that almost every single parent we work with has experienced. You start doing the mental calculations in your head, right? Like, how many words should they have by now? It is completely normal to feel a wave of worry in that moment, and I want to instantly validate that feeling for you.
Okay, let's dive into this, because that is the exact question keeping so many parents up at night. You're wondering, are they just the strong silent type, or is there an actual delay happening beneath the surface here? What we consistently find with the children and families we support at our clinic is that seeking answers really shouldn't be a source of panic. It's actually incredibly empowering. Understanding what's truly going on with your child's development is just always more useful than constantly wondering. We're here to help you replace all that anxiety with clear, actionable knowledge.
So, Phase 1, spotting the early signs. Let's look at what we actually focus on clinically, because early identification is literally the key to our highly successful developmental approach.
Let's start with the youngest group, our under-2s. We're looking for things like, not babbling or making a good variety of sounds by 12 months. Or maybe there's an absence of pointing and waving by that same age. By 16 months, we're typically expecting to hear single words. Also, if your little one isn't responding to their name or, and this is a big one, if they suddenly lose words they actually used to say, those are absolutely crucial early milestones to pay attention to. If these signs feel familiar to you, please know our DHA licensed therapists at Next Level are highly experienced in evaluating these exact things. Truly, there is no age too early to just ask for an expert opinion.
Now, as we move into those toddler years, ages 2 to 4, the expectations naturally shift a bit. By age 2, most kids have around 50 words and they're starting to string them together. If your child has fewer than 50 words, or if even close family members are finding them really tough to understand, that's a sign to jot down. But you know what the most common thing we see at our clinic in this age group is? Frustration. If your child is having frequent tantrums or just withdrawing entirely, we have to look at the why behind it. More often than not, a communication tantrum is just a child's way of showing you how incredibly hard they're struggling to be understood.
For kids aged 4 and above, the signs get a little more nuanced. We're looking for sentences that are noticeably shorter or simpler than their friends. They might have a really tough time doing something like retelling a simple story about what happened at school, or they might struggle to follow multi-step instructions. But most tellingly, older children might just start avoiding situations that require talking altogether simply because it feels way too difficult. If you see this happening, I gently want to remind you that just noticing this avoidance is your first, most positive step toward getting them the support they really deserve.
Moving on to Phase 2, understanding the delay. Once we've spotted the signs, we use our clinical diagnostic framework to figure out what's happening under the hood.
This brings us to a really vital distinction we make during every single assessment at our JBR clinic, the difference between speech and language. A speech delay refers specifically to the physical production of clear sounds and words, the articulation part of it. A language delay, on the other hand, is all about the meaning, the structure, and the actual understanding of communication itself. Some kids have one without the other, but honestly, a lot of them have both. We absolutely must distinguish them, though, because the therapy approach we use for a speech delay is entirely different from the therapy we design for a language delay.
And we can actually break language delays down even further. Expressive language is when a child understands what's going on around them perfectly fine, but they struggle to get their own thoughts out, so they understand much more than they can say. Receptive language is when the child actually struggles to understand what's being said to them in the first place. In our clinical experience at Next Level, a lot of children present with a mix of both. Pinpointing exactly where that breakdown happens, that's how we start unlocking their communication.
Now, what's absolutely fascinating, and something that busts a major myth we encounter literally every day, is this. Bilingualism does not cause speech and language delay. Living in a vibrant, diverse city like Dubai, we work with so many wonderful multilingual families, and parents ask us all the time, hey, is speaking 2 languages at home causing this delay? The answer is a definitive no. While bilingual kids might mix languages up a bit as they learn, they should still be hitting their overall milestones when you consider both languages together. Our therapists are experts in bilingual language development, and they know exactly how to assess this really distinct clinical picture.
All right, Phase 3, our approach to assessment. Let's completely demystify what it actually looks like when you walk through the doors of our clinic at the Fattan Marina Business Hub. We know bringing your child in for an assessment can feel super intimidating, but we've intentionally designed our process to be the exact opposite. Here's how we do it. First off, we're not just going to sit your toddler at a desk and hand them a worksheet. That wouldn't tell us anything useful. Instead, we start with natural play observation. We literally get right down on the floor and see how your child communicates when they're just having fun. Second, we deeply value your history and insights as a parent. We spend real time talking with you because, let's face it, you know your child best. Third, we give you a plain language explanation of our findings. Absolutely no confusing medical jargon. And finally, we create a uniquely tailored therapy plan.
Phase 4, how our therapy works. Once the assessment is done, we move into the active therapy phase, and I always tell parents right away that there is no one-size-fits-all program here. Everything we do is uniquely tailored to your child's specific clinical profile. Our whole goal is to meet them exactly where they are. The structure of our therapy is built around 45 to 50-minute sessions. For our younger kids, these sessions honestly just feel like highly structured, incredibly fun play to them. Because, children learn language best when it's embedded in meaningful, enjoyable interaction. For our older kids, we shift that focus slightly. We get them into storytelling, specific language concepts, and targeted vocabulary games that really prepare them for the social and academic demands of school. And finally, Phase 5, empowering you at home. Because as much as we accomplish in our clinic, the real magic happens when we partner up with you.
So, the crucial point is, we do not expect you to become a speech therapist. Your mom, your dad, and that is exactly who you should be. What we do is empower you with simple, really practical strategies that just seamlessly fit right into your everyday routines. Whether it's how you narrate your daily grocery run, how you share a bedtime book, or just how you respond when your child even attempts communication, integrating these small strategies at home accelerates your child's progress immensely. We want to make your involvement as easy and natural as possible.
And this brilliantly illustrates the sheer power of that exact partnership. 7,000. Over our 11 years of hands-on experience at Next Level Speech and Physiotherapy Center, our methodology has successfully supported over 7,000 children and their families. We've seen kids go from frustrated, quiet, and withdrawn to chatty, expressive, and just absolutely brimming with confidence. That incredible shift? That is the entire reason we do this work.
Which brings us to our final thought for today's explainer. If a worry about your child's communication has been sitting with you, if your gut is just telling you something is off, why keep waiting? Early support yields the absolute best outcomes, and booking an assessment with our team is just a supportive, totally low-pressure first step that gives you the information you need. After all, if empowering your child's voice could start with just one simple conversation, wouldn't you want to have it today?